This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic for the week of November 19th, 2020. I will note parenthetically that November 17th, 2019 is believed to be the first documented case of COVID-19 in an individual in China. So we are now at the 1-year anniversary. I'm going to divide my talk into 4 parts: the continued spread and growth of the pandemic worldwide, the change in the pattern of deaths in Europe, cases, hospitalizations, and deaths in the United States, and then the status of the pandemic in our region. Globally, the pandemic continues to grow with 1.36 million deaths and 57 million documented cases. But of considerable concern is a 4.9% increase in deaths just in the past week. As I've said before, I follow the week-to-week growth rate because it tells me whether the pandemic is slowing down or not. At a 1% growth rate, you can see that the number of cases grows very slowly. But at a 5% rate, it'll double in about 15 weeks, and at a 10% rate, it doubles in about 8 weeks. So 4.9% growth, it's worrisome. Now, it's nothing like the growth rate we saw early on, but that dropped very quickly down below 10%, came well down, and now appears to be going up. If you look back for about 2 months, the week-to-week growth rate was around 3.5%. That's not good, but it's nowhere as bad as what we're seeing in the last month, where it's 4 to 4.5 to 5%. At a 4.9% weekly growth rate in total deaths, we'll expect to get to 2 million deaths worldwide in about 8 weeks and to double in about 15 weeks. In terms of the 20 most impacted countries in the world, we will color code them as we always do, and you can see in red South America, white is Europe, dark blue is North America, and yellow is elsewhere. And we're just seeing a continued growth around the world. This is particularly worrisome, though. Early on in the pandemic, back in February, most of the deaths were in China. Then by early spring, mid-spring, they were in Europe, shown in green. Then by midsummer, most of the deaths are in the Americas, shown in orange. But look at what's happening in the last couple of weeks back to Europe. This is very worrisome and leads to the second topic this week, which is the change in pattern in deaths in Europe. What we saw in Europe was in the spring a very quick rise in the total number of deaths, and then months where the number of deaths really didn't change much until the last couple of weeks. And it's this upturn that has us very concerned. You can see that there was this is in Belgium, the most heavily impacted country in Europe. You can see that there was a slight increase in cases back in the spring. And then now we've seen this spike in cases. Unfortunately, it's been coming down. So it maximized around November 1st. But we're also seeing a spike in deaths, and hopefully it's starting to come down about 2 to 3 weeks after the spike in cases. So again, after weeks and weeks of being under 1%, the growth rate in Belgium has been 8%. And we're seeing this in all 4 of the most heavily impacted countries in Europe: Belgium, Spain, Italy, and the United Kingdom. This is worrisome because after weeks and months of not seeing significant growth, we're seeing this sharp upturn. Now, we don't know if this represents simply a matter of opening up. If they were really well locked down and then opened up, of course, it's going to spread into new previously protected populations. But there's a possibility that this represents a mutation of SARS-CoV-2 or a new wave of infections. I tend to think it's the first, but we don't know yet. In terms of the U.S., I want to make sure we pay attention to this sequence. Obviously, what you'd expect first in any community is an increase in cases, a couple of weeks later, increase in hospitalizations, a couple of weeks later, increase in deaths. In terms of cases in the U.S., this is where all the cases had been prior to August 13th, and you can see they were largely in the metro areas. But in the past 2 weeks, we're seeing this massive explosion. The entire upper Midwest, West, the northern part of our country is just being hit really, really hard. I'm a little bit concerned about this resurgence there and there. 12 million cases in the U.S. This is a time lapse. It'll take us from July. This is where the cases were in the U.S. in the 2 weeks before July 24th. And again, you can see largely in the Southeast. And then as I put it into motion, there's not really much going on. You don't see any clustering. And suddenly we see an explosion in Alabama, but then not much. And then all of a sudden, this incredible growth rate in the Dakotas, Wisconsin, Illinois, such that now, again, it's largely the entire middle part of our country with resurgences. And again, as I mentioned, it appears to perhaps be resurging as well. So again, we saw a spike in cases in March, followed by a slow spike in cases in July, and now we're seeing another spike in cases. And of course, following cases is hospitalizations. The week-to-week growth rate this week is 3.7%. And as you can see, the rate of hospital growth and hospitalizations went up, and down, following those trending cases. But now you can see for the past few weeks, it clearly looks like it's going up, actually for the last couple of months. And then following hospitalizations, of course, will be deaths. We've had over 250,000 deaths just with this pandemic so far this year. And the week-to-week growth rate is 3.8%. And again, what we see is we saw this 2.5% growth rate for several months. That's not good, but it's not terrible. But then in the last couple of weeks, we've seen this increase. And at 3.8%, we'll expect the number of cases to hit 300,000 in about 4 weeks before Christmas. So this thing is not over. It's growing considerably. What we're not yet seeing is a significant change in those places that were most heavily impacted in the United States: New Jersey, New York, Massachusetts, and Connecticut. We're beginning to see a slight indication that there may be an uptick. We'll have to keep a close eye on that. But again, the vast majority of cases right now are in the middle part of our country. In our region, we're getting hit pretty hard. Over 4,000 deaths in Tennessee, almost 4,000 deaths in Virginia, and over 500 deaths just in our region. Virginia, as I've pointed out before, has been sort of hopping along, growing a little bit faster than the U.S. overall. This compares where all the cases had been as of August, and then the cases in the past 2 weeks. And what you can clearly see is, at least in the past 2 weeks, is clustering down here in the south and western part of the state, especially in our region. Tennessee, on the other hand, has been popping along. This growth rate is really concerning. This is where all the cases had been in Tennessee as of August 13th, again, largely in the metro areas. But look at this. In the past 2 weeks, this entire state is being slammed with COVID-19. This is a time-lapse picture that I put together that takes us from early August to the present. And what you can see, initially there were clusters out west, and then some in the northeast and some in the middle. But then all of a sudden, in the past couple of weeks, this thing is just blowing up statewide. This is really concerning. And, you know, as my grandfather would have said, any damn fool can tell that what we're doing isn't working. That's not to say that there's anything that we could have done to prevent this, but clearly it's not being controlled in our state. Following cases comes hospitalizations with a 5% week-to-week increase. This has been pretty consistent over the past month and a half, maybe going up slightly. And again, as I've said before, if you have a 5% growth rate, you're going to double in about 15 weeks. If you look at our region, we're clearly being hit, whether you look at Southwest Virginia, Northeast Tennessee. Our week-to-week growth rate this last week was over 9. And at that rate, we will expect the number of deaths in our region to double in about 8 weeks by Christmas. So the bottom line is COVID-19 is still spreading widely in the world with perhaps an increasing growth rate in total deaths, meaning that we are growing, perhaps getting worse. 8 of the top 20 most impacted countries are now in South America, but Europe is also being hit pretty hard. The U.S. remains in 8th place in the world with 789 deaths per million, with most of our growth being in the northern areas. We account for about 1/5 of all the cases and deaths in the world. And there appears to be a resurgence of deaths in the most impacted countries in Europe. We're not sure what that is or whether it's going to continue. We're not seeing a comparable resurgence yet in the United States. though our growth rate continues to grow. And finally, the Appalachian Highlands appears to be in the heart of one of the most heavily impacted areas in the United States. And we have to conclude that what we're doing isn't working. It's not a political statement. It's simply an observation of the statistics. What we are doing isn't working. We have to really focus on the things that we believe can work. Avoid crowds, wear masks, engage in social distance, which means minimize the amount of time you're near people and maximize the distance. Implement good hygiene, hand washing, coughing into your elbow, and so on. Stay home if you're sick. We need to do a much better job of testing and contact tracing, quarantine, and isolation. We have to continue to protect the elderly and those with chronic conditions. And most importantly, we have to keep following the data and allow the data to help our thoughts and actions change. And let's see if we can't rebuild trust in our federal regulatory and public health agencies by allowing science to dictate our perceptions and our actions. It's time for all of us to acknowledge that what we're doing, what we're thinking, how we view this pandemic isn't working, and we need to do more. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. You can contact Jan Stork at this email address. As always, I'd like to thank Melissa White for updating most of these slides and Dara Young for editing, producing, and posting this video. If you have any questions, comments, concerns, criticisms, please let me know. One of the most important things we can do in this pandemic is keep up with the latest information. I answer a lot of emails offline when folks have specific questions. If you have anything that you want to know that I can help with, please let me know. I look forward to hearing from you.